The kidneys are often referred to as the silent organs because they can deteriorate without any noticeable symptoms, and once they are damaged, they can never fully recover to their original state. When kidney function fails, the remaining options, such as dialysis or a kidney transplant, become a reality. Therefore, preventing chronic kidney disease from advancing has become a critical concern. A groundbreaking 10-year study conducted in Japan has provided promising insights into this issue. The kidneys are located above the waist, with one on each side of the body. They play an important role in filtering the blood that circulates throughout the entire system. When the kidneys are under continuous stress, their function gradually declines. If this impaired state lasts for several months or more, it may be diagnosed as chronic kidney disease, or CKD. Once kidney function declines chronically, it cannot be restored. Kidney health is typically measured by a blood test that calculates the estimated glomerular filtration rate, or eGFR, which indicates how well the kidneys are filtering waste. Chronic kidney disease is classified into 6 stages based on the eGFR level. A lower eGFR indicates a decrease in the kidney's filtration function. When the eGFR falls below 60, entering stage G3A, the condition is officially classified as CKD. At stage G5, kidney function is considered severely reduced. One patient shared her experience. When my physical condition was at its worst, I was sleeping for about 20 hours a day. I was only awake for meals and baths. Otherwise, I was constantly sleeping. I felt incredibly exhausted and heavy. I realized then that even though they are just kidneys, they are truly vital organs. In 2024, this woman began going to a clinic for dialysis. This treatment uses a machine to take over the work of weakened kidneys by filtering waste and excess water from the blood. The hospital where she receives treatment has 40 beds, most of which are occupied by dialysis patients. During a session, a nurse says, "I'll tie this now," and the patient agrees. The nurse aims from above to start the process. The session begins at 1:28 p.m. and is scheduled to end at 5:30 p.m. Regarding how it feels during dialysis, the patient says, "Nothing really changes. It feels normal, just like usual. There is nothing special to it. I just try to find ways to kill time while waiting." However, it is a major concern during disasters like earthquakes. If something like that happens, you just have to be prepared for the worst. Near the end of the session, she experiences a cramp. The medical staff decides to finish the session as her blood pressure is at 110. After the procedure, she says, "I feel fine right now, totally normal. But after I get home and some time passes, I usually start feeling sluggish. My body feels heavy and the fatigue sets in." In 2008, a research team led by Dr. Yamagata partnered with doctors across Japan to launch a large-scale study called FROM-J, involving approximately 2,000 CKD patients. Researchers monitored these participants for several years and then conducted a follow-up 10 years later. The participants were divided into 2 groups. One group received standard outpatient care, while the other group received intensive lifestyle and dietary guidance. The guidance group was monitored to see if they avoided smoking and took their medications properly. They also received dietary counseling every few months. The results after 10 years showed a significant difference in the rate of rapid decline in eGFR among those with mild to moderate CKD. In the standard care group, 20.9% experienced a rapid decline in kidney function. However, in the group that received lifestyle and dietary guidance, the rate was much lower at 14.2%. Furthermore, Cardiovascular disease occurred in 10.5% of the standard care group, but in the guidance group, the incidence was only 6.1%. Dr. Yamagata explained that the intervention group showed better control of blood pressure and BMI. The registered dietitians reported that patients became more diligent with their medication and stabilized their daily habits, which clearly demonstrated the effectiveness of the guidance. The From J study team developed a dietary guidance manual, and the results were evident in a 61-year-old patient with mild to moderate CKD. Over several years of support, the patient's weight dropped from 80.5 kilograms to 71.5 kilograms, and his blood pressure decreased from 150 to 126. His kidney function, measured by eGFR, remained largely stable. The approach was not about strictly forbidding certain foods, as that causes stress. Instead, the focus was on reducing the frequency of consumption, or the portion sizes. Using a checklist from the manual, they assessed factors like BMI, blood pressure, blood sugar, lipids, salt intake, smoking, and protein intake. For a male patient showing risks in BMI and salt intake, they suggested adjustments to his breakfast, such as switching from ham to scrambled eggs seasoned with ketchup to reduce salt. Since bread also contains salt, they suggested thinner slices. For lunch, dishes like katsudon are difficult to manage because the rice is soaked in salty sauce. They suggested separating the rice and the topping to prevent the sauce from soaking in, making it easier to control salt and energy intake. For dinner, they recommended minimizing meat and focusing on rice and beans. Regarding alcohol, CKD patients can drink in moderation, about 350 milliliter or 500 milliliter beer per day, provided they have days off from drinking. However, those with high uric acid should be more cautious. They were also advised not to pour soy sauce directly over sashimi, but to dip it lightly to avoid excessive salt intake. The patient received dietary guidance 12 times over a period of 1.5 years. Even years after the sessions ended, his kidney function showed no significant decline. Because CKD is a disease with few symptoms, some patients stop going to the hospital, only to return when the condition has become severe. Therefore, continuous nutritional guidance and regular medical visits are vital. It is estimated that if this intervention were implemented nationwide, approximately 4,500 new dialysis cases could be prevented over a 15-year period. Regarding salt restriction, research showed that for men, increasing the frequency of dietary guidance was the most effective method. For women, providing objective information about their condition, such as their CKD stage worsening, or the need to see a specialist, was more effective in encouraging them to follow salt limits. This difference in how genders respond to lifestyle guidance is a very interesting finding. The goal is to find ways to prevent the worsening of the disease in those with mild cases. Exercise has also been shown to reduce protein in the urine and improve kidney function. Creating a society where people maintain healthy lifestyles before they even need medical intervention is the ideal future. In 2024, a research team in Japan analyzed data from 600,000 adults and found that 1 in 4 people aged 65 or older had CKD. Among those aged 75 and older, the number rose to 1 in 2. In 2020, the International Society of Nephrology recognized a class of drugs called SGLT2 inhibitors as a breakthrough. These drugs have been shown to significantly slow the progression of renal failure and reduce mortality. Normally, the kidneys filter blood and reabsorb sugar for energy. In diabetic patients, the kidneys are overworked by filtering excessive sugar. SGLT2 inhibitors prevent this sugar from re-entering the blood and help the body excrete it through urine. This allows the kidneys to rest. A study showed that while 14.2% of the group not taking the drug experienced a significant eGFR decline, only 9.2% of the group receiving the drug experienced the same. The mortality rate was also lower at 4.7%, compared to 6.8% in the non-drug group. While these drugs are effective for those near renal failure, more long-term research is needed for those with very mild case. Professor Maruyama is developing a new treatment using adipose-derived stem cells, ASCs. These cells are taken from the body and administered to patients. In studies with rats that had severe renal failure, the administration of these stem cells resulted in a 100% survival rate, which was a dramatic improvement. The team discovered that the injected stem cells gathered mainly in the spleen, rather than the kidneys. The spleen activates immune cells, and microscopic images showed the ASCs attaching to and activating these immune cells. These activated cells then travel to the kidneys to reduce inflammation. In 2024, Maruyama conducted a clinical trial with patients suffering from IgA nephropathy, a condition where 40% of patients eventually require dialysis. In the trial, patients with mild symptoms received 1 dose, while those with severe cases received 2. In this disease, the capillaries in the kidneys are damaged, causing protein to leak into the urine. After the cell therapy, the group that received 1 dose saw their urinary protein drop by more than 50% on average the next day. The group that received 2 doses saw similar results after each treatment. This numerical evidence of improvement was a major milestone, and no serious side effects were observed, confirming the safety of the procedure. However, the effect is not permanent, as the cells disappear within about a week. Maruyama believes that 1 or 2 doses are not enough to maintain the effect, so his team is preparing another trial, where stem cells will be administered multiple times to patients in advanced stages. He hopes to save even those in the most serious conditions. Ultimately, your own awareness is what makes the difference in preventing a disease from progressing. When you sense something is wrong, taking steps to change your daily life with professional support can be transformative. The long-term studies in Japan show that steady, gradual efforts are the key to a healthier future. If this story changed the way you look at the silent health of your internal organs, please subscribe and like our channel. We are uncovering the medical history and the future breakthroughs that they tried to keep hidden. Let's cultivate a healthier future together. The next treasure of knowledge will be opened soon.